Welcome to America's Premier Experts. I'm Jess Todfeld, your host, Dr. Scott Schumann. I like to call him the Jack Hanna of dentistry because he always brings something interesting and it may bite.
Hopefully not today.
I think
today we're going to be safe on that. But
thank you for coming back.
It is so great to be back. I had a blast last time.
My
patients love seeing me on here. We got some new people in, really helped some people that were suffering from things they don't need to be suffering. And so I was grateful to be on, and I'm grateful to be back on again.
Well, I love you. You're on the cutting edge, in my opinion, because you're always finding out something new. In fact, you brought the very, very latest, something that we've been seeing pop up in the Olympics.
Yes.
Tell us.
I can't wait, and actually, we're going to hold off on telling you about the new Under Armour Performance mouthwear because we have a little video that I want to show, and and you were with me last night when I got the page on my cell, like, oh my God, did you see the driver from the Olympic bobsled team, the U.S. Olympic team, broke a new world record, holding his Under Armour mouthpiece. So it's all. So I know you don't want me to wait, do you? You want me to go right to this part?
I do. I want you to jump into it.
All right, here we go.
It's amazing to me how this thing helps athletes. I would never have thought about it being the case. Tell us.
Well, there's been some anecdotal evidence over the years about, hey, let's go back to Roman days.
Yeah.
When the Roman soldiers are out there beating up as they're conquering the world, biting on leather straps to get that. You have Native American women having babies, biting on a wood stick. And then
you're saying there's something to that.
There's something to that. Bite the bullet while they were doing surgery during the Civil War. Well, this here, I'm telling you what, I love this case. It's really neat. But this is really what it's going to look like.
Yeah.
Something like this. I'm telling you.
And hold it real still here for the camera.
You can see that over there. But here is like the Armor Bite technology. What this really does for you. Now, if you're an athlete, if you want to get that legal edge, the legal edge, not doing steroids or anything, this is your whole angle. If you're going to, this study they did showed increase of your strength by 17%, 25% increase in endurance. I mean, it's all about those in the Olympics, milliseconds.
Yeah.
But let's say you're a high school kid, you want to make the first string.
Right.
Let's say you want to get to college. What about the NFL guys going to the combine right now? Those guys running their 40. If we can make it go this a little bit different, what's that contract worth?
Yeah,
you know
it's
what I'm
worth
saying?
a lot.
It's worth a lot.
Now this looks to me like a little piece of plastic, but there's a lot of big technology behind it.
Big technology.
Tell me how it works.
The way it works is it really, when you're working out, you start stressing, you're really doing all this stuff.
Yeah.
What it does, it loads your jaw, releases some bad hormones, which is good for maybe a short period of time for that, you're frightened, so that flight type thing.
Yeah.
Well, long term, it actually works against you. Decreases your strength, decreases your endurance, decreases your oxygen, and what this does is help prevent that hormone being released by decreasing the stress here. Next thing you know, increased power, increased strength. I mean, we got professional golfers using this stuff now.
Yeah.
Now, and you have to be an authorized Under Armour provider, which, of course, I am.
Yes.
And, we have the hockey team, Blue Jackets. These guys are wearing that. You saw some Olympic guys that we have on the team wearing it. And you'll see the Under Armour. We even have some of the linebackers from the Cincinnati Bengals. You can see the little Under Armour logo right there. I mean, it's just great. And as a whole, dentists have always said, we're a mouth guard.
Right.
Basketball, lacrosse, football. But now with this Armor Bite technology, this is custom made, scientifically proven, we're getting some increased performance from this.
Right.
So, jaw-dropping performance, that's what I like to say about this.
So you have athletes who are, many of them, like you mentioned, Cincinnati Bengals, who are already wearing some sort of mouth guard, but this now takes it to the next level.
Given that legal edge that we're talking about. We even have the Arnold Classic, one of the greatest bodybuilding expos in the world is in Columbus, Ohio next weekend. And we actually have, we've sponsored some of the power lifters, and the gentleman we have, Tao, he's, wait till you see his picture. It's amazing. But third in the world, no steroids, competing guys that weren't being tested.
And, like I had said, you're the guy who always seems to be on the cutting edge, a little bit step ahead of everybody. And I know we brought it up last time, but when people come into your office and you give them the brand new smile, the perfect smile that they want, you have a way where they come through, they don't have to think, worry, feel anything. What is that about?
Well, I tell you, we found that some people are, I don't know, they don't like the dentist like we talked about before.
Yeah, when we're kids, we remember.
It was like a weird, but dentistry's come a long way. And in my office, we have advanced technology. And so in my team, listen, I have a killer team. These girls are trained to take care of you. They're your advocate. They're going to fight that insurance company, that same levels they had from the 60s. $1,000 bucks. What's that going to cover?
Right.
Not when you have I haven't gone to the dentist for...
They're making calls themselves?
Oh yeah, they call the insurance, they fight to make sure you get every little benefit that you possibly can have.
Really?
And they're finding ways, like we have ways of financing, you know, let's say you want a whole bunch of veneers. Let's say you need a new set of dentures. Let's say you want implants.
Yeah, yeah.
It costs a little bit. You got to invest in that. It's not just a $50 copay for that, but they'll find ways so you can spread it out that'll fit your budget.
Right.
And that's their job, to take care of you. They got blankets for you, headphones for you. Some people say they don't like the noise, the drilling noise.
Yeah, yeah.
I even have earwax the NASCAR racers wear while they're driving.
Oh, yeah.
We have all that stuff for you, and TV. So if you want to watch Family Guy, Simpsons, the news, it doesn't matter. Whatever you like, put it on. Just lay back and relax. And of course, you know the best thing, sedation. It's phenomenal.
Yeah, what is this, sedation dentistry?
It makes life so much better. I mean, think of going to...
Not everybody's using this, right? I mean,
well,
you're also, again, you're ahead of the curve on this.
You have to have some extra training and some, and you have to invest in some advanced equipment to be able to monitor you, so make sure it's safe. And we don't want a Michael Jackson situation happen in my office, and it's just not going to happen. So it's easy. You get a few pills, you get some gas, you go to La La Land, and then it just goes by.
It's like, done and done.
What? Where am I? What happened? I go, oh, you just got a gorgeous smile is what happened.
Right.
And everybody's happy with that. And there's people that are afraid to even walk in the building.
Yeah.
There's people that are just too busy. Like, look at you. I mean, you're busy. You're traveling around, interviewing, doing these shows.
We're both here in Hollywood right now.
And so, hey, you're going to come in Friday afternoon, you're done. And that's beautiful. And so that's what we really provide. We had a lady the other day, and she goes, I waited all this years for nothing. She said, I couldn't believe how easy it was.
Yeah.
She didn't take any pain pills afterwards, and we did some extensive work on her. And so she was grateful, and it worked out. And I think we have a clip of, it just kind of shows where what they're living with that they don't need to.
Yeah,
they don't need to. Let's just show this real quick.
Sal Caputo never thought this was going to be part of growing older, but years of dental neglect eventually led to dentures, as it has for 20 million other Americans. Now they're slipping.
I couldn't talk properly. I couldn't eat properly. And you get paranoid and you say, well, next time I won't go out to dinner with them. So little by little you start getting alone. You're all by yourself.
The problem is that even well-fitted dentures eventually cause the jawbone to be resorbed, leading to loosening, and dentures never work like real teeth.
The maximum efficiency that a patient has, even with well-fitted dentures, no pain, is about 25% biting power of what their teeth were.
Wow, 25%.
Yeah, it's sad. I mean, let's say we have 100%, and then without the teeth and the bone resorbing, you're down to 25% chewing efficient. Think of a lawnmower with only one wheel on it. That's what we're talking about here. And you saw the sadness in him. I mean, he couldn't eat. He was embarrassed by his smile. He couldn't talk with confidence, and he started isolating himself. I mean, how's that affect your relationships? How's that affect your job? And he didn't even go over to his friend's house. He didn't want to insult the wife from her cooking, which he loved. He just couldn't eat. Well, he's got some implants, and I tell you, here's a couple models here.
Yeah,
just because people don't know, hey, what's all this implant stuff? I'm telling you, it's as simple as an artificial root with a little denture.
Real still here for the camera.
Okay, and it's basically a couple snaps, and then listen to this. Snap.
That's how it snaps into.
Snaps into place. Retention, stability. All of a sudden now, because of these implants, these artificial roots. Now, some people, they're a little bit stronger guy. Well, I have this thing, real name's called Hader Bar, but I call this the guardrail. I mean, if you're a really strong guy that grits and does all, this is what you need. We put a few more in, more stability. Again, snap.
Just snaps in.
Isn't that great?
Snap on.
Snap on.
Right.
Snap off. You know.
That's right.
And so, like here, like the big problem with the dentures on top is that we have usually the denture covers the whole palate. Look at this.
Right.
There's no palate there. 4 snaps, 4 implants. Put them on right here. Snap. And then they can eat, talk, confidence. But now this is open. They can taste their food. They can talk better. It's just so much better.
So for the people that this works for, is the big fear that their teeth are going to come out?
Well, they do come out
moment?
while they're eating, while they're talking. You've seen the videos on YouTube where the lady's skydiving and it falls out, or she's getting married and it falls, or communion and it goes into the wine.
Worst possible time.
That's not good.
Right, and there's the anxiety behind it. But this solves this?
Solves it. Snap in. It's beautiful.
Snap in.
But it only does that. You can eat better now. Your nutrition's better. Your health's better. And then it stabilizes the bone. You don't get that bone resorption they were talking about in the video.
Right. And the hidden benefits? Confidence,
Listen, if you can look in the mirror and feel good about the way your smile is, like people have those worn yellow dentures or yellow teeth.
Yeah.
We make cosmetic dentures. You're gonna have a gorgeous smile when we're done. It's gonna look like you had ortho and you had veneers put in. It's people love it. Well, if you can do that, you're gonna be better at work. And the reality is, we don't like to say it, but people judge you when you do not have an ugly, when you do have an ugly smile.
Yeah.
When there's cracked, chipped, crooked, yellow teeth. They're going, well, what's wrong with you? Why aren't you taking care of the brown holes? The brown hole is not a good thing on your front tooth.
But the best part is you look at something like that and you say, that is not that hard to fix.
It's easy. I mean, people come in, oh, I'm so bad. I'm like, no, listen, relax. It's okay. We can fix it. There's no embarrassment in this. We're just so glad you're here. We're going to find out why you didn't and resolve those issues.
Right.
And then it's a new path, and that's all we worry about is that. And sometimes, like we had a guy in the other day, and he had one of those long, like, hillbilly teeth. You know, you sit down there.
Yeah,
because that hillbilly tooth, that snaggle tooth is bugging me.
Right.
I said, brother, just sit down here, because it bugged me as well. And I tell you, in 10, 15 seconds, he's a level smiler all of a sudden. And didn't have to numb, didn't have to do anything. Now, he went ahead and whitened his teeth, and we took care of some other things, but within that amount of time, that was fixed. So it's great.
And the part that gets me too is, and you said, and we're just about to go to break here, you told me that sometimes it may only be 5 or 10 minutes to get the perfect smile. And people have been putting it off for years.
Putting it off because they're afraid it's going to take too long, it's going to hurt, pain, time. I go, just come in and see what we can do.
Right.
You know, and our website has some free report, has some videos, some testimonials of people.
Where can people go for that?
I tell you, GroveCityDental.com.
Say it again for everybody.
GroveCityDental.com. And it has areas to click on reports, has sedation dentistry, cosmetic dentistry, implant dentistry. How to raise your kids. And you know, one of our saying is, we want you to drink all your pop, your sports drinks, your energy drinks, because do the do, pay the shoe. You know,
the Mountain Dew.
The Mountain Dew. Gosh, and it's all about the acid level. It's the sugar, but people do it, and we're trying to help keep your pocketbook in you and keep you healthy. That's what we're trying to do.
I love it. You're always on the cutting edge. We're going to have you back.
Okay, great, awesome.
Dr. Scott Schumann, you are the best. Thanks for being here.
Thank you. Thank you so much for having me. It's a pleasure.
Monday.